Listen, the world is drowning in wellness fluff and keyboard experts. Welcome to the RLND podcast, where we don't sugarcoat health, and we certainly aren't going to whisper about the truth. I'm Dr. Matt.
And I'm Dr. Adrian. We're chiropractors. Yeah, but more importantly, we're here to knock some sense into the noise. You don't need another guru. You need clarity, grit, and a spine that actually works.
This show's about real health, the kind that's earned, not bought. No gimmicks, no filters. Just science, experience, and maybe a few uncomfortable truths that most docs won't say out loud.
So if you're ready to stop coasting, start owning your health, and maybe challenge everything you've been told about your body, let's get to work. But before we get too far into today's episode, the Realigned podcast is brought to you by the Walton Clinic of Chiropractic. You can find out more info by going to waltonclinic.com.
Also, smash that follow button to follow the show. Share it with someone who needs to stop making excuses. And buckle up, because we're about to get realigned. Today we're tackling something pretty fascinating, maybe even a bit unnerving for some people, that sound you sometimes hear during a chiropractic adjustment. What is that? And the big question, are these adjustments actually safe?
Yeah, it's a really common question, and it definitely gets to the heart of how people see chiropractic care. You see so much stuff online, hear stories, and naturally you start wondering, wait, is this okay? What's really going on, right? So our mission here today is really to cut through that anxiety. We want to give you a clear evidence-based picture of the safety and the mechanics of spinal adjustments.
Right.
Exactly, not hearsay. We want you to feel informed, maybe even empowered about this kind of health approach.
Yeah, based on science data, clinical experience, not just, scary YouTube clips.
Right. It's the immediate association, isn't it? Totally. And people react so differently. Some folks really like it. They feel this immediate release. Others, though, it makes them instantly nervous. They worry, wondering, did something just break?
Let's just dive right in then, because I think for a lot of us, the first thing that pops into mind with chiropractor is that sound, that pop or crack.
Okay, so that sound, the technical term is cavitation, and it's actually pretty neat what's going on. It's basically a quick release of gas, mostly nitrogen, some carbon dioxide. These gases build up as tiny bubbles in the synovial fluid inside the joint.
Synovial fluid, that's the lubricant in the joint.
Precisely.
It sounds dramatic. So, okay, scientifically, what's happening? What makes that noise?
Think of it like little pockets of lubricating fluid. Gas can dissolve in there, form little bubbles under pressure. When the joint is moved quickly and gently during an adjustment, the pressure changes fast. Those bubbles basically, they pop. That's the sound.
All right, gas bubbles popping. Is there like an everyday example? Something to help visualize it?
Oh, absolutely. Think about opening a can of soda or sparkling water. You pull the tab, you hear that pop or hissing sound, right? You're not breaking the can, you're just releasing the built-up pressure, letting the dissolved gas escape fast.
Okay, that makes total sense. So the joint crack is like that hiss, it's just pressure release, gas escaping. Yeah, not bones breaking.
Yeah, exactly. It's physics, not danger. Just gas bubbles popping in the joint capsule. It's actually a pretty natural thing.
So if it's just gas, does the sound even matter? Like, does an adjustment have to make that pop sound to work? What if it's silent?
That is such a key point. The sound, the pop, it's just a side effect. It's not the goal of the adjustment at all. An adjustment can be perfectly effective, restoring motion, helping the joint function better, influencing the nerves, even if there's zero sound.
So the goal isn't the noise, it's the movement and the release.
Precisely. Restoring proper joint mechanics, helping the nervous system. You shouldn't be chasing the crack. If it doesn't happen, it absolutely doesn't mean the adjustment failed.
Okay, that clears up a lot, but if it's just harmless gas bubbles, why all the drama? Why are there so many myths and frankly scary stories out there about adjustments? Where does that come from?
Well, it's a mix of things, really. Hollywood plays a part, Movies love to exaggerate things for dramatic effect.
Oh yeah, the quick neck snap, like Jean-Claude Van Damme?
Right, which just doesn't reflect actual clinical practice. And then there's the huge influence of, the internet, YouTube, and TikTok.
Oh yeah, where context goes to die sometimes, you see these viral clips often edited for maximum shock value.
Right, exactly that. Those clips are almost always taken completely out of context. They're short snippets. They don't show the assessment beforehand. They don't explain the patient's condition, why that specific move was chosen, right? In reality, every single adjustment is or certainly should be carefully tailored to that specific person.
Right. That seems like a really important distinction. It's not some generic, forceful thing you see online. It's personalized.
Absolutely. A good chiropractor considers your age, your health history, the specific state of your joints, your comfort level, all of it. It's highly individual.
So proper assessment comes first.
Always. A thorough exam, talking with the patient. It's about understanding you and your needs, not just applying some technique blindly. I've had patients come in nervous because of something they saw online, but then they experience a gentle, specific adjustment and their whole view changes.
Okay, that makes sense. Which brings us, I guess, to the main event, the big question. Are chiropractic adjustments safe? What's the bottom line from the data?
The bottom line, the concise answer is yes. Overwhelmingly for most people, chiropractic care, especially spinal adjustments, is considered very safe.
And that's based on evidence.
Yes, a large body of scientific evidence, decades of clinical practice globally. It's not just an opinion.
Okay, but some people do worry about serious risks, again, from what they see on the internet, or from what they've heard from their sister-in-law's third cousin's uncle's friend. How common are serious risks, really?
The risk of a serious complication following an adjustment is exceptionally low.
How low are we talking?
The estimates vary slightly, but they're often cited as low as, say, one incident in several million adjustments. It's incredibly rare.
1 in several million. Wow, how does that compare to other things we might do?
Well, here's something that often surprises people. Your risk of having a serious adverse effect from a common over-the-counter pain reliever,
Like ibuprofen.
exactly like ibuprofen or Aleve, things many of us take pretty casually for a headache or sore muscles. The risk of serious side effects like gastrointestinal bleeding from those is significantly higher than the risk of a complication from a chiropractic adjustment.
Wow. Taking an Advil carries a higher statistical risk of serious harm than getting adjusted. That really puts it in perspective.
It does, doesn't it? It helps frame the level of risk we're talking about. But maybe you're still skeptical, right? There's another indicator of safety, a really powerful one from the real world.
Okay, what's that?
Malpractice insurance. Insurance companies are all about assessing risk. That's their business.
Follow the money.
They use cold, hard data statistics on claims to set their prices.
Makes sense. So what do the premiums tell us about chiropractors versus, say, medical doctors?
They tell a very, very clear story. Chiropractors pay vastly lower premiums for their malpractice coverage compared to most medical doctors. On average, a chiropractor might pay somewhere in the range of, say, $2,000 to maybe $3,000 a year.
Okay, and medical doctors?
Depending heavily on their specialty, of course, but they could be looking at $15,000, $30,000, $50,000 a year, sometimes much more for high-risk specialties.
That is a massive difference. So what does that gap tell us about the risk involved in what they do?
It tells us exactly what the clinical data shows. The procedures chiropractors typically perform are inherently low risk. This isn't because of some backroom deal or lobbying. It's a direct reflection of the risk profile based on actual claims data. The insurance companies, whose job it is to quantify risk, have priced it accordingly. Lower risk equals lower cost. It's a real-world financial measure of safety.
That's actually a really compelling point. The insurance market itself, based on data, essentially backs up the safety claims. It's not just anecdotal.
It's a financial reality based on millions of patient interactions and outcomes.
Okay, so we have the science of the sound, the myths debunked, the safety stats, the insurance angle. How does all this play out in the clinic? How should chiropractors practice responsibly day to day?
It really starts with very careful patient screening. Before any adjustment happens, a responsible chiropractor does a thorough health history, a detailed physical exam.
Looking for specific issues.
Yes, specifically screening for what we call red flags. These are signs or symptoms that might suggest a more serious underlying problem, something where spinal manipulation wouldn't be appropriate or safe.
And that might involve looking at x-rays or MRIs sometimes.
Absolutely. Reviewing imaging when it's clinically necessary adds another layer of understanding about the patient's structure and condition. It's about being thorough.
Not guessing.
Definitely not guessing. It's about making a careful determination. Is this person a good candidate for this specific type of care? And crucially, if the screening suggests they aren't, or if they need a different kind of help.
Then what?
Then we refer. A chiropractor's job is to help, and sometimes the best way to help is to recognize when the patient needs to see a different kind of specialist and make that referral. We don't just proceed if it's not appropriate. Our training allows us to know when chiropractic care is likely safe and effective, but also critically when to pause, maybe consult with another provider or refer the patient elsewhere to their GP, a neurologist, an orthopedist, whoever is appropriate.
It's about knowing our scope, knowing when to treat and when to refer, like all doctors should.
Exactly. It's fundamental to safe, patient-centered, collaborative care. Responsible practice hinges on it.
So, wrapping this all together then, the core question, safe, statistically based on those incredibly low complication rates. Yes. Clinically, with that careful screening and diagnostic process, yes. And even from that surprising angle, the malpractice insurance data, looking at real-world risk, absolutely yes.
That's the picture the evidence paints, but that doesn't mean you should just walk into any office off the street.
Good point. What's the caveat?
The caveat is the importance of choosing your practitioner wisely. You want someone who is licensed, who's experienced, and crucially, who takes the time to really understand you, your history, your needs.
It's not just about getting cracked.
Far from it. A good chiropractor, the focus isn't just the sound or even just the adjustment itself. The goal is much broader, which is, it's about restoring proper motion, reducing pain and interference, improving how your nervous system functions. Ultimately, it's about helping you move better, feel better, and live your life with, more ease and less restriction.
Getting back to doing things you enjoy without being held back.
Exactly. Helping your body function more optimally. So if you've been curious but maybe a bit hesitant because of the myths or the online noise, we get it. But hopefully understanding the science and the safety data helps. Don't let misconceptions stop you from exploring something that genuinely helps a lot of people improve their quality of life. Yeah, it's about making informed choices for your own well-being.
Absolutely. And maybe that leads to a final thought for you, the listener, to consider. If the goal really is moving through life with more ease and less restriction, what other health or wellness practices might be out there, maybe also misunderstood or unfairly judged by popular perception, that could be worth exploring with that same informed, critical, yet open mind?
Exactly. What else are we maybe missing out on because of myths or lack of understanding?
If today's episode rattled your comfort zone, good. That's what it's supposed to do. We're not here to pat backs and play nice. We're here to get you thinking, moving, and taking action. Because if your spine's out of whack, chances are your mindset is too.
Do us and yourself a favor. Hit that follow button, share this episode, and leave a review that isn't just emojis.
Health doesn't happen by accident. It happens by decision. So make one. We'll be here next time, still telling the truth and still cracking more than just joints.
Until then, move better, live sharper, and stay realigned.